Project 2025, is it a problem when it comes to your Medicare? If you haven't heard of Project 2025, that's okay. I hadn't either until just recently. There has been a lot of chatter of how bad it would be for Medicare beneficiaries if these proposals were enacted. Project 2025 is a 922-page book or document published in 2023 and put out by the Heritage Foundation. Project 2025 states, Project 2025 is a historic movement brought together by over 100 respected organizations from across the conservative movement to take down the deep state and return the government to the people. Its mandate for leadership, the conservative promise, published in April 2023, is a product of more than 400 scholars and policy experts from around the country. The book offers a menu of policy suggestions to meet our country's deepest challenges and put America back on track. Wikipedia states Project 2025, also known as the 2025 Presidential Transition Project, is an initiative by the Heritage Foundation. It aims to promote conservative and right-wing policies to reshape the United States federal government and consolidate executive power should Donald Trump win the 2024 presidential election, unquote. While this document goes into many things, I am only going to take a look at what it says and suggests when it comes to your Medicare. I have no interest in reading the rest of the document. I simply want to review their suggestions when it comes to Medicare and let you know from an agent's perspective who has worked with thousands of Medicare beneficiaries across all socioeconomic levels, all political spectrums, all ages, and all health conditions. I have personally been in thousands of homes and sat across the table of many Medicare beneficiaries, and I have seen and heard firsthand what they experience when it comes to their health care, and their Medicare coverage and the cost that comes with it. So keep watching for hopefully a politically agnostic view on Project 2025 when it comes to your Medicare. Hi, I'm Chris Prang, the Medicare analyst, licensed agent in 14 states, and I am based out of Charlottesville, Virginia. Maximizing your Medicare should be very important to you, and my goal is to help people like you make a wise and confident decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. If today is your birthday, then a very happy birthday to you. Voltaire said, God gave us the gift of life. It is up to us to give ourselves the gift of living well. On page 283 in section 3, titled The General Welfare, here's what it says. When our founders wrote in the Constitution that the federal government would promote the general welfare, they could not have fathomed a massive bureaucracy that would someday spend $3 trillion in a single year, roughly the sum combined spent by the departments covered in this section in 2022. Approximately half of that colossal sum was spent by the Department of Health and Human Services, HHS, alone, the belly of the massive behemoth that is the modern administrative state. HHS is home to Medicare and Medicaid, the principal drivers of our $31 trillion national debt. When Congress passed and President Lyndon B. Johnson signed into law these programs, they were set on autopilot with no plan for how to pay for them. The first year that Medicare spending was visible on the books was 1967. From that point on through 2020, according to American Main Street Initiative's analysis of official federal tallies, Medicare and Medicaid combined costs of $17.8 trillion, while our combined federal deficits over that same span were $17.9 trillion. In essence, our deficit problem is a Medicare and Medicaid problem. I have to concur and would hope everyone who studied the history of this nation's founding would agree that the founding fathers certainly didn't envision such a massive federal debt brought on by lawmakers, government agencies, and government programs. On page 450 in section 4, titled Department of Health and Human Services, Goal number 2, empowering patient choices and provider autonomy, basic economics holds that costs tend to decrease and quality and options tend to increase when there is robust and free competition in the provision of goods and services. Healthcare is no exception. Healthcare reform should be patient-centered and market-based and should empower individuals to control their healthcare-related dollars and decisions. My thoughts. I agree that costs tend to decrease and quality and options tend to increase when there's competition. But when it comes to healthcare, we as consumers have tens of thousands of medical professionals to pick from. We have thousands of hospitals to choose from, dozens of pharmacies we can get our medications from. There's a lot of competition when it comes to where we get our healthcare services, but healthcare inflation tends to run higher than regular inflation. So what gives? Well, if I had a hunch, the main issue is the payment system when it comes to healthcare. Whether it's relying on the government as the primary payer or subsidizer of healthcare expenses as in Medicare, Medicaid, the marketplace plans, or insurance companies. There are tens of thousands of different medical codes that all have their own unique payment rate. And what each payer pays the provider for those different codes varies from payer to payer and from provider to provider. An example, an insurance company can pay one amount to one provider and a different amount to another provider for the exact same medical code. In my view, it shouldn't matter who the payer is, whether it's the government, an insurance company, a nonprofit, or an individual. There should only be one price the provider charges and accepts. Next, quote, of course, providers who deliver health care also need the freedom to address the unique needs of their patients. States should be the primary regulators of the medical profession, and the federal government should not restrict providers' ability to discharge their responsibilities or limit their ability to innovate through government pricing controls or irrational Medicare and Medicaid reimbursement schemes, unquote. My thoughts, yes, of course, providers who deliver health care also need the freedom to address the unique needs of their patients. One of the challenges with this is a provider may want to use an alternative treatment or alternative protocol, and that typically means Medicare or Medicare Advantage won't cover it. And that, of course, means the provider won't get paid. And that seems to be their point when they say the federal government should not restrict providers' ability to discharge their responsibilities or limit their ability to innovate through government pricing controls or irrational Medicare and Medicaid reimbursement schemes. Should states be the primary regulators of the medical profession? States already have some oversight of healthcare and the medical profession. When it comes to Medicare insurance, states regulate Medicare supplements when it comes to their rates and who can and who can't qualify for Medicare supplement. States probably should have a greater oversight of the medical profession simply because typically the closer to home the government is, the more effective it is. Personally, I think more healthcare oversight needs to be on the local level, but that likely will never happen. The challenge with this is so much of healthcare is on a federal level. If every state has a different set of laws or rules and insurance is portable, meaning you can use it anywhere in the country, I could see some real nightmares happening. Next, quote, finally, America's broken insurance system, run largely through confusing provider networks and third-party payers such as employers, induces overconsumption of healthcare, limits consumer shopping, and hides true costs from patients. The federal government should focus reform on reducing burdens of regulatory compliance, unleashing innovation in healthcare delivery, ceasing interference in the daily lives of patients and providers, allowing alternative insurance coverage options, and returning control of healthcare dollars to patients making decisions with their providers about their healthcare treatments and services. My thoughts. I pretty much agree. The question is, how do you make that happen? The greatest way to have healthcare freedom is to be self-pay. There are two ways to do that. One, you don't rely on insurance and pay out of your own pocket for medical care. You would be free to choose any provider and any treatment anywhere you want. Obviously, that does not work for most people. Two, medical sharing through religious groups. The Amish and Mennonites typically pool their money and cover each other when it comes to healthcare. And from seeing it firsthand, it works pretty well. Also, medical sharing ministries are similar where a group of people help cover each other's healthcare needs. In both cases, these groups are generally healthier than the general population, so that does help. And they are not as restricted when it comes to alternative treatment that Medicare or any other insurance wouldn't cover. If there was some way to do that on a local level, that might be beneficial. The biggest drawback with medical sharing and being self-pay is even though you typically get a discount for being self-pay, that discount is nowhere near the discounts that Medicare or regular insurance gets you. Example, my daughter needed an MRI, so I shopped around. UVA Health wanted $3,000. I found a place that would do it for $900. Meanwhile, one of my Medicare Advantage clients got an MRI at UVA, and UVA charged her $6,516 for it, but her Humana Medicare Advantage plan got $6,374 of it knocked off and left my client with only $142 to pay. There's no way, even though I tried, to get a discount like that. And that is why I think the final price should be the same regardless of who pays and how it is paid. And now we get to the important part. In their section, Centers for Medicare and Medicaid Services, they state, quote, With the goal of being a societal safety net, Medicare and Medicaid touch more American lives than does any other federal program. While they may help many, they operate as runaway entitlements that stifle medical innovation, encourage fraud, and impede cost containment, in addition to which their fiscal future is in peril, unquote. I concur, and I think most Americans and most Medicare beneficiaries do as well. Will it ever change or change by much? I don't have much hope in that. What about you? They go on, quote, both programs should be managed so that the individuals enrolled are empowered to make decisions for themselves and have quality options with affordable prices driven by competition and innovation. Providers who participate should retain or have restored the freedom to practice medicine and take care of their patients according to the patient's unique needs, unquote. I agree. Now here are the suggestions under Medicare, quote, Medicare should be reformed according to 4 goals and principles. Number 1, increase Medicare beneficiaries' control of their health care. Patients are best positioned to determine the value of health care services working with their health care providers. They also benefit from increased choices of doctors, hospitals, and insurance plans. Access to reliable information with respect to physicians, hospitals, and insurers is therefore essential, unquote. Sounds reasonable to me, but does this mean that anything goes? Could a person choose any treatment they want and have it covered by Medicare or Medicare Advantage? If that happened, I see costs going much higher, not lower. Number 2, reduce regulatory burdens on doctors. Doctors must be free to focus on treating patients first, not entering codes on computers, and should not be tempted to change their medical judgment based on arbitrary or illogical reimbursement incentives, unquote. Dealing with medical codes is time-consuming and inefficient. This forces some doctors to bill for as many codes as possible just to get paid a sufficient amount for their time and service. If you are a doctor, I am curious as to what you think about this. This is one reason why more doctors are going to a concierge type service. This is when you pay an annual fee or membership to your provider and receive more flexible and creative care. They don't take Medicare or any other insurance. Value-based care also addresses this and is growing in popularity. It pays providers based upon the quality of care and its outcome versus a fee-for-service that pays based upon quantity of care. Number 3 goal, ensure sustainability and value for beneficiaries and taxpayers. Prices are best for patients when determined by economic value rather than political power and when they are known in advance of the receipt of services. Government's use of non-market-based methods to determine reimbursement leads to overspending on low-value services and products and underpayment for high-value services and products. It stifles beneficial innovation, and because of Medicare's size, distorts payments throughout the healthcare system. Intermediate entities that can manage financial risk and ensure quality of care are important in transitioning to value-based care within the Medicare program, unquote. Does the government through Medicare overpay? Yes, it does. Do they underpay? Yes, they do. Number 4 goal is to reduce waste, fraud, and abuse, including through the use of artificial intelligence for their detection. I think we all want that, but who's going to oversee AI and making sure it's actually detecting fraud? Do providers do treatments that are unnecessary and bill for it? Is there a lot of fraud when it comes to doctors doing or billing for unnecessary treatment? Yes. If you doubt that, just Google doctor billing fraud, and I highly recommend the book, The Price We Pay by Johns Hopkins Dr. Marty Makary. Then, in this document, they have regulatory reforms. Here's what they say. Quote, additionally, regulations should advance site neutrality by eliminating the inpatient-only list and expanding the ambulatory surgical center covered procedures list. Medicare generally pays more for inpatient hospital procedures and less for the same procedures performed in an outpatient setting. Whether a medical service is delivered in a physician's office, a clinic, or a hospital setting, the Medicare payment for that service should be the same, unquote. Why would Medicare pay more for the same procedure at an inpatient setting versus an ambulatory surgical center, which oftentimes is next to, right near, or even attached to the hospital? The only thing I can think of is the larger the setting, the less efficient it is, and therefore more costly. If you have any expertise in this, please let me know in the comments section below. Then under legislative proposals, they suggest 1. Remove restrictions on physician-owned hospitals. The Affordable Care Act imposed restrictions prohibiting Medicare from reimbursing physician-owned and specialty hospitals, unquote. That certainly sounds reasonable to me, and there is some legislative action right now addressing that. Number 2, encourage more direct competition between Medicare Advantage and private plans. Medicare Advantage, a system of competing private health plans, is a major alternative to traditional Medicare for America's large and growing cohort of seniors." Unquote. There's already plenty of competition. Quite frankly, there are way too many plans to pick from. This makes it more confusing and harder for Medicare beneficiaries to determine what plan is best for them now and long term. It also causes greater churn during the annual election period and special enrollment periods. Every time there's a disaster, there's an SEP, and then all the telemarketers start calling Medicare beneficiaries to get them to change their plans when they don't have to or need to. I think insurance companies should be limited on the number of Medicare Advantage plans they can offer in a state or geographic region. Number 3, the program provides beneficiaries with a wide range of competitive health plan choices, a richer set of benefits than traditional Medicare provides, and at a reasonable cost. Equally as important, the MA program has been registering consistently high marks for superior performance in delivering high-quality care. Unquote. For the most part, that is true. There are reports where Medicare Advantage plans offer better healthcare outcomes, and other reports where they say they are about the same as original Medicare. The issues with Medicare Advantage are provider access, prior authorizations, which is not as bad as people lead you to believe, just see the report by the Kaiser Family Foundation, and potential for huge out-of-pocket costs. And their number 4 is critical reforms are still needed to strengthen and improve the program for the future. Specifically, they suggest the following. Number 1, make Medicare Advantage the default enrollment option. As Medicare Advantage is right now, no, that is a very bad idea. What happened to choice and freedom? I think most people with Medicare Advantage have no idea what they really have and don't have. Making it the default option would only make it worse. Number 2, they say, give beneficiaries direct control of how they spend Medicare dollars, unquote. Sure, but what do they mean by that? Is the government going to give me a certain annual allotment that I can spend on health care? And if everyone had direct control of their Medicare dollars, does this mean having access to any doctor or hospital or any service, healthcare treatment, or medication I want, and then I'm free to have any treatment my provider recommends? If that's the case, that will drive up fraud and spending on frivolous and unnecessary care, for sure. Number 3, they suggest remove burdensome policies that micromanage Medicare Advantage plans, unquote. I am not sure what policies they were referring to. I can tell you that they should stop micromanaging when it comes to marketing Medicare Advantage and Part D plans. They are childish and unprofessional rules they mandate, but that is the government. But because the government funds or subsidizes these plans, they feel like they have the need to have some oversight. And number 4, they state, replace the complex formula-based payment model with a competitive bidding model, unquote. That sounds good, but I don't know what they mean by that and or how it would work. Number 5, reconfigure the current risk adjustment model, unquote. Probably, but how? I hate it when someone says something needs to be changed but doesn't offer a solution. Number 6, remove restrictions on key benefits and services, including those related to prescription drugs, hospice care, and medical savings accounts, unquote. Might depend on restrictions. Their premise is all of this is to provide greater freedom, greater competition, greater care at a lower cost. But with less restrictions, that could cause prices or insurance premiums to increase quite a bit. What do you think? Then under the section Legacy Medicare Reform, legislation reforming legacy or non-MA plans, Medicare should base payments on the health status of the patient or intensity of the service rather than where the patient happens to receive that service. That sounds good to me. Replace the bureaucrat-driven fee-for-service system with value-based payments to empower patients to find the care that best serves their needs. That is starting to occur, but will take a while to take hold. They go on. Codify price transparency regulations. Yes, there should be price transparency, and there should be one price regardless of who the payer is. They suggest restructuring 340B drug subsidies toward beneficiaries rather than hospitals. I'll be honest, I don't know enough about it to comment. They go on, repeal harmful health policies enacted under the Obama and Biden administrations, such as the Medicare Shared Savings Program and an Inflation Reduction Act. I can't speak to the Medicare Shared Savings Program. When it comes to the Inflation Reduction Act, time will tell. Right now, it will save some people money, but the majority will have to make up for it by paying increased premiums, deductibles, and co-payments, Or now the government is going to step in and subsidize even more, which is using taxpayer dollars and borrowing money. It will likely also limit access to certain medications and create greater barriers of care getting certain medications. And as I'm recording this, I have heard that one company's premiums are going to be $90 to $120 per month. Apparently, when CMS received plan bids from the insurance companies, the premiums were much higher than CMS anticipated. I don't know how they missed it. Everybody else was able to predict that the cost would go higher. What did they think would happen with putting a $2,000 cap on the out-of-pocket? Of course, premiums have to go up. So Medicare's knee-jerk reaction was to create the Part D premium stabilization demonstration. In a CMS release, they said that the average bid amount for 2025 was $179.45 per month. And that's up from $64.28 for the 2024 plans. So now CMS is in panic mode and has devised a plan for the government to offset these huge increases. And how do they do that? Again, with taxpayer money and borrowing money. As of now, CMS estimates it will have to subsidize the plans by $142.67 per month so Medicare beneficiaries don't get sticker shock, or worse, have a heart attack when they see their annual notice of change coming in September to October. We continue. The Medicare Part D reform section, they state, quote, the Inflation Reduction Act created a drug price negotiation program in Medicare that replaced the existing private sector negotiations in Part D with government price controls for prescription drugs. These government price controls will limit access to medications and reduce access to new medication, unquote. Look, the whole medication price thing is a mess. The private sector isn't doing that great right now. Americans pay way more for medications than any other country. Why did they not mention the PBMs, the pharmacy benefit managers? They are the biggest issue and barrier to more affordable medications. Why no mention of not being able to get a generic version in the US when you can in other countries? I have little confidence the Inflation Reduction Act will reduce inflation. And the last time I checked, when the government negotiated prices, they pay way more than the private or public sector would for the same item or service. As mentioned earlier, as of now, the Inflation Reduction Act looks to be a financial disaster for Medicare beneficiaries as a whole and the government. They state, quote, this negotiation program should be repealed and reforms in Part D that will have meaningful impact for seniors should be pursued, unquote. Maybe. There's definitely some very simple things they could do to make Part D better and more affordable. They also suggest, quote, other reforms should include eliminating the coverage gap in Part D, reducing the government share in the catastrophic tier, and requiring manufacturers to bear a larger share, unquote. Well, the coverage gap is gone starting in 2025, so we don't have to worry about that. Not sure if the government pays less and that manufacturers pay more, as in making a smaller profit will actually help. I can certainly see if the pharmaceutical companies have to pay more during the catastrophic stage, they'll just increase the price of their medications. Getting rid of the PBMs would probably be the best thing, but that is unlikely to happen. If you have another idea, please let me know in the comments section below. And lastly, they state, quote, until the Inflation Reduction Act is repealed, an administration that is required to implement it must do so in a way that is prudent with its authority, minimizing the harmful effects of the law's policies and avoiding even worse unintended consequences, unquote. Of course. So, conclusion. They do give a number of proposals that would be helpful to Medicare beneficiaries, but they don't really provide the solution. It's possible that some of their proposals could result in what they don't want, and that is higher costs. Other than that, I personally don't see much of anything in their proposals that would be real detrimental to Medicare beneficiaries or that Medicare beneficiaries should be scared of, except for mandating Medicare Advantage as the default and automatic health insurance for Medicare beneficiaries. I'm really curious as to what you think about Project 2025's Medicare proposals. Please comment if you have some expertise or insight, but please only keep it to the Medicare proposals. If you have questions about what I've just gone over and when you are ready for help in maximizing your healthcare and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states which I'm licensed in, which you can see here, then please, by all means, feel free to reach out to me either by phone or through one of my contact forms on my website. We will have, I hope, a very open and honest conversation about your healthcare needs and philosophies and budget, and I will do my best to answer all of your questions and concerns that you may have. Once we determine what is best for your unique needs and budget, I will then enroll you in the plan or the plans of your choice and, of course, be available down the road for your support. To stay up to date and to gain more insight on maximizing your Medicare insurance, then please go ahead and subscribe. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prang, the Medicare analyst. Make it a great day.